welcome. All right, I have opened a new tab on Internet Explorer, or Chrome actually it looks like, and I am at Google, and I'm just going to start there. So I'm working on a research paper about art as a replacement treatment, medical treatment. And this is a kind of a new concept, but I'm thinking about ADD, ADHD, and PTSD primarily. So I typed in art replacement medical treatment. That does not seem to be popping up anything quickly. So I'm going to say art, let's see. Art therapy for PTSD. Okay, we have some scholarly articles. We have some art therapy. We have foundation, art and healing. So this is obviously something that other people are working on, which sounds great. I am going to actually go to scholarly articles for art therapy. The effectiveness for art therapy interventions in reducing post-traumatic stress disorder in pediatric trauma patients. And it seems that we've got a nice little article here. And if I were at my home or somewhere that I needed to be, I would read this article and probably save the PDF on my page. So that's something I would like to look into. It looks like we've got quite a few combat-related PTSD, which is something I would like to possibly focus on. Is listed. Looks like veterans. We've got some veterans stuff, military veterans. Definitely interested in looking at those. I'm also incredibly interested in PTSD for abuse victims. Victims of physically violent abuse, trauma-informed art therapy. So literally popped up a whole bunch of stuff here on Google. Calm through creativity, how arts can aid trauma recovery. NiceSolid.gov. We're on the Family and Youth Services Bureau. And seeing a ton of articles, actually a ton of information that would help support my theory that drugs are not the answer. Prescription drugs are not the answer for solving PTSD problems, whether it be war victims or trauma victims. I would also like to maybe look into medicinal. Actually, I guess it would be prescription or pharmaceutical, actually. Pharmaceutical lobbyist. In Washington. I want to look at amount 2015. I heard a fact / opinion, not sure which one, that big pharma, which would be, here we are, big pharma. How much of big pharma's massive profits are used to influence politicians? And this is the root of the problem. We're overly medicinalizing our kids who are usually trauma victims, and that's why they're being pumped full of drugs. And the reason is because our government is under the duly effect of money from big pharma. In other words, our government is in the drug business. This article probably has quite a bit of opinion, but again, I would save this, I would research it further, and I would probably use that to cite how big pharma is influencing the government, who is influencing our healthcare, who is encouraging drugs and medicine, which encourages I believe it encourages patients to seek, patients seeking diagnosis for drugs, for pharma. How drug companies are turning us all into patients, right there, .gov. They over-glorify being sick, whether it's ADHD or PTSD or cancer, and instead of selling therapeutical values that would actually increase the quality of life, like healthful eating, normal exercise, and primarily art, as far as I'm concerned, we're selling people drugs, which just becomes addictive. So here we go, direct-to-consumer advertising of drugs and patients, how you can't turn on a television and not see 400 commercials while you're watching cartoons with your kids about erectile dysfunction and the drugs that'll help you. So we've got some scholarly papers, some university publications, direct-to-consumer advertising of drugs and patients' health care seeking behaviors. This has all been researched and done, and I am looking forward to delving more into it. I'm really not having any problems finding what I'm looking for at this point. If I were researching independently and alone and not for research, then I would already have a lot to go on. I'm actually going to stay on Google, and I'm going to type in Alzheimer's, because I think that's an interesting look. Alzheimer's diagnosis, or actually Alzheimer's and art. Why don't we just type that? Alzheimer's art therapy. How we go? My art therapy is good for the Alzheimer's brain. There's just a blog. And yet, I like independent theories. Art therapy has proven to be a powerful tool for treating, not just diagnosing, but treating Alzheimer's. More than giving patients something pretty to look at, it stimulates the brain, it stirs memories, and can bring language back into the life of someone who struggles to speak. So, I would like to, yes, I would read this. It would probably, more than anything, classify as opinion, but it does look like they've got some good stuff in here. My next course of action would be then to go back to Google, and I want to kind of, I believe all art therapy works, but I want to kind of narrow in on painting. So I'm going to say painting stimulates which area? Brain area. The mental health benefits of art are for everyone. Art in the brain and the learning process. Cerebro and mente. Right side of the brain. Most people have been accustomed. Okay, quite a few articles, but found one. That seems quite interesting. Beta emitted, different rays, and total use of the brain. Again, all things that are associated with art, and really I believe that the power of healing, again, is within the mind, within art, stimulating the brain with good nutrition, exercise, and art therapy, and not pharmaceuticals, addictive pharmaceuticals. Again, that would be another direction I would go at this point. Addiction levels, pharmaceuticals. 2015. It's pretty general. I think it's more about pill relevance. I think honestly, popping pills right here, drug abuse, prescription drug abuse in America. The National Institute on Drug Abuse, drugabuse.gov. There we go. And I think it starts from childhood. Kids are diagnosed with ADD, ADHD, hyper disorder, blah, 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 on the spectrum for autism. And instead of being worked with and taught creativity and exercise and proper nutrition, they are instead taught how to take a pill. And the pill makes them feel happy. The pill makes them feel like somebody cares. And so therefore, that becomes the misnomer. This popping pills, we've got some diagrams, we've got all sorts of words. I'm sure it's all interesting. I would love to look at this adolescent brain over here. Again, it's that the brain is still developing, continues into the 20s, and we're giving these kids pills from childhood. And I wonder how much the world would change if we just put a paintbrush in these kids' hands, or a guitar, a piano, access a piece of paper and a pencil, and allow them to work their brains through. So tons of information here. Again, I would save this. This would probably be a point of reference. Okay, going back to Google. I'm also going to look at, okay, percentage children on drugs. We're going to say prescription drugs. 2015. On children over-medicated. First thing popping up. 2015. National Institute of Mental Health. Recent symposium at the Carter Center. As many as 10,000 toddlers may be receiving psychostimulant medication like Ritalin. Reports decried the over-medication of children. And again, this all feeds into why we have such an epidemic at this point in society, with everyone needing an immediate fix with a pill, when truly what they need to fix cannot be fixed with a pill, but requires something far greater. At which point I would probably go back to the places. I mean, there's just more information than you could ever need. I would probably go back to my saved places and start compiling facts and opinions and support that art therapy, art in general, our doctors should stop. Okay, I don't want to do this anymore. U.S. prescription drug versus the world. Wow. It does seem to be an epidemic. Hooked on pharmaceuticals. Drug Watch abuse in America versus abuse in the world. This, I have heard this fact before. This is interesting. Americans consume 80% of the world's pain pills. And then I would probably start, that would almost be the beginning right there. Why the epidemic? What are the solutions? And how do we stop that from being the norm in the future? Another, I guess, interesting thing to look up would be how many government-sponsored are programs. Yes, that would be exactly what I was trying to type. National Endowment for the Arts. You know, they'll put forth a... You ready?
Ready.
Okay.
Awesome.
Awesome.
Let me stop the video.